If you've struggled with chronic pain for months, maybe even years, and continue to take a very myopic view of this, then watch this video so you can understand how to take a more holistic view of understanding and getting rid of your chronic pain, possibly for good. Hey, I'm Dr. Sam McDonald, brain health expert, helping you rewire your brain so you can live a better life. If you love this content, make sure to like and subscribe so you get the notifications for each week's new video. Struggling with chronic pain can be a very debilitating condition. It can really wear on you. It can cause things like depression. It can ruin your life in some instances. And if you have a chronic pain issue, you need to understand you have to look at chronic pain not just in a single lens, but it has to be looked at through multiple different lenses. So let me give you an example. So if you have a chronic knee pain issue, you cannot look at this thing only through a orthopedic lens, meaning you're looking at the joint, you're looking at the soft tissue around it, you're looking at your range of motion. You cannot look at it this way. Pain is a very complex neurological signal, and many different things can amplify your pain. So if you're considering and looking at how can you reduce what's going on in the knee, yes, you need to look at it from a structural perspective. We have to look at the soft tissue. We have to look at the joint. We have to look at the muscles that are supporting and surrounding it. We also have to look at the nerve communication to it. So understand that your body has many different types of nerve fibers that communicate different pieces of information. Each nerve bundle that comes out of the spine actually has 9 different types of nerve fibers that communicate 9 different pieces of information. So looking at the knee, for example, if your knee is hurting and you've never looked at something like maybe a just simple reflex, tapping the knee and seeing is there actually a reflex that's present there. If it's absent, understand that neurologically speaking, this is damaged and this is compromised. One, the muscles are not supporting the joint through its full ranges of motion and activity. But two, understand that that whole reflex arc connects into the spinal cord to inhibit pain at the spinal cord level. And if it's not firing, guess what? That knee's going to hurt more. Understand that things like inflammation, stuff that you eat, is going to have a huge effect on pain and it feeling worse than if it wasn't there. So things that you put into your body, if you have a leaky gut and you have an increase in inflammation because the immune system is attacking these different food proteins entering the bloodstream, this is going to cause an increase in your pain because of how the nerves are now dysfunctioning. So nerves have a resting membrane potential. And as inflammation starts to eat away and destroy these nerves, that resting membrane potential now becomes closer and closer to what's called threshold, meaning that nerve is going to spontaneously fire. Now, understand. Now, an example of this would be something like if you bend your leg and contract your hamstring and it cramps up, this can be a very easy example of that nerve spontaneously firing, which causes that muscle to contract even though you don't really mean for it to happen. This can happen in a lot of other different senses. So if these nerves are continuously, spontaneously firing, they're not functioning appropriately, they're not inhibiting pain at the spinal cord level and up into the brain, and they're not doing their job. So this will continue as well because if inflammation continues to creep up, it's going to cause damage into the brain as well. Brain can't inhibit some of these other underlying neurological pathways, and you're going to feel pain even more. Even things like emotional pain or emotional problems can actually cause an increase in inflammation and can cause problems in the brain, which can lead to an increase in physical pain in the body. So symptoms and things like fibromyalgia from a PTSD type of event can cause an increase in pain too. So understand, you need to look at a problem, again, using the knee as an example, you need to look at this from multiple different perspectives, not just one. So you can't just go and do a detox and lower your inflammation that way. You can't just try and stretch the joint out and strengthen it, or take medications, or have cortisone injections, or possibly even look at surgery. You can't just do that. You can't just look at it from a neurological perspective and only consider how the nerves are communicating to it. You have to look at it from a holistic perspective. We have to look at the structure, we have to look at the nerves, and we have to look at the metabolics as well if you're really, truly wanting as complete resolution as you possibly can get. So you need to take your health into your hands and you need to start looking at this from a bigger perspective, not just one single myopic thing. On that note, you should be healthy by choice, not by chance, and for that reason, I will see you on the next video.